See.
Hello, doctor.
All right, right side.
Right side.
Right side. All right, I got to put my initials on the right side.
Right.
Not just the right, but the correct.
Autograph
There we
me.
go. That's it.
Now wait a minute. They just told me to scrub my arm till I couldn't get all, and then you just put magic marker on my arm.
Not as it just magic marker, but this actually has a substance in it that will actually kill MSSA, the MRSA.
Hey, well,
and fungus
color
in there.
me purple.
That's right. In here. What's that? If it was there, it would actually kill some of that stuff.
Okay, good.
Venetian or Genetian violet is what they actually use as the
about
coloration in there.
Wow.
So it'll
That is cool.
it can do that sort of stuff.
Okay.
All right, so the right side. So plan for today.
So you're
So a
going to
couple
put a
of-
scope in.
It's a couple of small incisions. 1, 2, 3. Put the camera in there, and we're just going to look at everything. We'll take pictures of everything first. We're going to look at the cartilage, the labrum, the biceps, the rotator cuff, the end of the humerus, and the glenoid there. And if there's anything that's frayed, then we're going to clean it up or trim out whatever's causing irritation. Those things are rubbing together. If we would find something that needs repaired, which I'm not anticipating, I don't expect to. We have an MRI.
Right.
We got good strength and range of motion. But if we see that, we'll take care of it. I'm also going to then put the camera not in the joint, but below the shoulder blade, above the tendon, so we can see the end of the collarbone. We can see the bone spurs from underneath there, and that's where that Mumford procedure, or sometimes called a subacromial decompression, is the non-named sort of descriptive term for it. So we can make that more space so the tendon isn't rubbing back and forth. It's not sliding and grinding back together.
Right.
Okay, so the idea is then once the inflammation of surgery goes down, then we have painless range of motion and we can get past this, okay? Your body will always react to this as if you just had a traumatic event. We put these probes in here, we put these instruments in here, your body thinks, oh, I got impaled by something. Okay? So the nerves get ramped up. So it will be sore. Ice, pain medication, Tylenol, ibuprofen, Aleve, that sort of stuff, as you need it. If we don't repair something, and again, we're not planning to, we're hoping not to here, you're going to be allowed to use and move the arm as much as feels comfortable and you want to. If we end up needing to repair something, and you'll be able to see that in the pictures if we need to, then there'll be more limitations, meaning you're not allowed to because we don't want to disrupt a repair. Again, I don't think that's going to be the case. I don't want that to be the case.
Yeah, we're thinking positive
not.
here.
But that's just the two possible scenarios from that standpoint. Okay?
Okay, you said, let me try to recap. If you don't have to make any repairs, I should only need the sling for 3 days? Or
You
3
can get
days?
rid of it as soon as you want. You'll have a sling today because your arm's going to be numb. And if you don't have the sling on, your arm's going to dangle down like this.
Yeah.
And she's going to shut in the car door.
Like
and
I
that's
Dead
what
weight.
it is.
I did that at
So
the
it keeps it up
restaurant.
out of the way.
Right.
And then you can get rid of it in a couple of days whenever it feels comfortable for you. You're going to be allowed to start moving it and using it. It'll feel sore, but you're not going to damage or mess anything up by moving it around.
Okay, now, if I take the pain medication, and I try to start using it,
Yep.
and I'm not feeling any pain and I'm using it, is there any chance of me damaging something because I can't feel that I'm damaging it?
Not if it's not repaired. If it's just a clean-out procedure that we would be doing, then no, you wouldn't be messing anything up.
Okay, and so I'm going to get my space back.
That's the idea. Yep.
Tell me about the clavicle thing again.
So on the end of the clavicle here where the bones can rub together and there's no natural cartilage there again, we're going to actually trim the clavicle back by about 1 centimeter so that everything still moves past each other. The ligaments are all intact, but the bones don't grind together.
What's the
A
other
centimeter is a very small
A chrome-
space. There's not more of a space between.
There's usually
Really?
even less.
Is
There's
that
usually, the bones are naturally touching each other, but they have cartilage on the ends of them. So then as they move past each other, they're nice and smooth and nothing's irritated. And then over time, that cartilage starts to calcify and becomes little bone spurs, and now they grind together.
Yeah.
And that irritates and causes the pain. So now we get it so they rotate past each other without actually touching.
But there's no cartilage. It's just air, or
It's
I
a
mean,
bone.
no,
You
I
mean
mean
that afterwards?
Yeah.
Correct. It'll fill in with a little bit of rubbery type scar tissue type stuff that doesn't have nerve endings to it.
Okay. Is there any kind of a thing to make it that'll make it go back together later?
Not usually. I guess I couldn't say for sure. You couldn't regrow some sort of bone spurs or things like that, but that would be highly unusual.
Okay. All right. Can you say hi to
Sure.
give everybody thumbs up? Thumbs up for the surgery.
Good morning. All right, other questions?
follow up with you. It's what, 3 weeks?
Usually it's about 10 to 12 days. We'll make sure we've got
It's in the
something-
calendar.
We'll make sure we've got something scheduled that makes sense.
I've
for you.
already got it written down somewhere.
Yeah.
What kind of pain meds?
They usually either give Norco or Percocet.
Okay.
I don't know if you've got better or
Yeah,
worse
well,
experience with one or the other.
no, Norco. It sounds familiar. I think I had that.
Percocet's a little
I
stronger.
had that after whatever it was when I had my extractions done.
Mm-hmm.
They gave me. I know they gave me Percocet.
They probably had Norco too.
Percocet's a little stronger of them. And then you
Okay.
only need to take it for the first couple of days as it's sore. Obviously, don't drive if you're taking those
Yeah,
sort of
no,
things.
I'm not driving.
And then when you say, oh, it's still sore, but it's tolerable, then switch over to a combination of Tylenol and ibuprofen.
How about a leave?
Fine.
Okay.
Tylenol and Aleve is good.
Okay, and PT.
We'll see what it looks like. If we don't have to repair anything, then we won't start with PT. We'll just let things rest until you see me back the first time. If we have to repair something, PT won't start for 6 weeks.
Okay. Let's do this thing.
All right, let's
High
get taken care of.
five.
All right. Dr. Coates, our anesthesiologist, she'll come talk to you and get you taken care of.
All right, thanks, Doc.
Welcome.